Hello everyone, and welcome to this audio podcast. This audio podcast interlude. This audio podcast is part of a Bulletin beat, and this audio podcast is part of a Squadron Bloca, and this audio podcast is part of a Labonics POCE, and this audio podcast is part of a Storm Robotics production. In this audio podcast, sort of looking back, really, looking back and sort of looking at works from 2013, collaborative works from 2013 in within an academic institution in the southwest in the United Kingdom, but also in works was sort of collaborative between colleagues, between several colleagues, and linked to allied health professions, but also linked into in part of a division of musculoskeletal research, and this works is works was works which was peer reviewed and published after this sort of initial works was presented, and this works looks at diagnosis, management, and assessment of adults with joint hypermobility syndrome, or JHS. And this works was a UK a UK survey, where a UK survey was done in amongst the profession, aligned to and linked to physiotherapy and physiotherapy practice. In around this interlude, then, joint hypermobility syndrome is a heritable disorder associated with excessive joint range of motion and pain in the absence of inflammatory joint disease. Symptomatic joint hypermobility has been reported to affect approximately 5% of females and around 0.6% of males. Although it is common, it is a common cause of pain. Pain. Although it is a common cause of pain, it is generally at the same time understood to be under recognized and poorly managed in context of clinical practice. And before going on further and just sort of following on, as a sort of a side note to the intro of this works, when in the literature at the time of doing this, of being sort of part of this works, it's collaborative works from 2013. The literature around joint hypermobility syndrome was somewhat vibrant. However, at the same time, there was a general sort of consensus in amongst literature, and looking at literature, that that in around clinical practice, or in around the management of the sort of inflammatory aspect of joint hypermobility syndrome, that within general practice, or practitioners within primary care, within primary care, did not know or would not know how to support patients who suffered with joint hypermobility syndrome. And hence this work sort of delved into sort of the diagnoses, management, and sort of how to assess actual joint hypermobility syndrome versus sort of this symptoms or symptomology that may look and appear to be a joint hypermobility syndrome. So the aims and objectives of this works, if you like, was to identify how joint hypermobility syndrome is diagnosed, managed, and assessed in routine sort of practice, as routine practice, and where specifically where specifically or particularly this collaborative works looked at joint hypermobility syndrome. Um, um, Joint hypermobility syndrome in around the profession of physiotherapy practice. So in around the methodology of this works, successive drafts of the survey that had been formed and implemented were developed from similar practice service similar practice similar practice surveys previously, and a literature review and a consultation with researchers and clinicians also before being finalized. Paper versions or paper formats of the survey were sent to 201 randomly selected secondary care organizations across the United Kingdom. An electronic version was advertised through physiotherapy professional networks, and the results were also analyzed and presented using or utilizing descriptive statistics. So in around the analysis and results of this works, a total of 66 responses, around 80% of females were received from physiotherapists with a range of clinical experience. Around 68% of the respondents reported that they had not received any formal training in around joint hypermobility syndrome management. Just under 70% of respondents reported not using or utilizing the recommended criteria, which in literature have been referred to as the Brighton diagnostic criteria for joint hypermobility syndrome. An average service offers a sort of a first assessment of at least 40 minutes, 40 minutes, and follow-up appointments of around 30 minutes or less, with a maximum of six consultations across 4 months. 30% of the respondents offer maintenance consultations or reviews at sort of where they responded as always or frequently. Um, so in just sort of to describe some of the data in this works. So in around the question, what is the duration on average of the first assessment? Around 86% said more than 40 minutes. In around the response to what is the duration on average of each treatment sort of consultation, 95% had said less than 30 minutes. Another in around how many sessions on average do you offer, including the first assessment? The response was 79, and around 79% had said less than six sessions or consultations. And then, over what duration on average do you treat each individual with joint hypermobility syndrome? Around 72% had informed around 54 months. Around in around had mentioned 72% of respondents had said less than 4 months. And then in a round of response, do you provide a follow-up maintenance sort of review for individuals with joint hypermobility syndrome or JHS. 39% had informed rarely or never, and around 30% are always had responded as always or frequently. So the aims of the physiotherapy and specific interventions seemed sort of had seemed sort of well placed, with a focus on advice, physical activity, and physical activity and self management. So in around uh, some further descriptive statistics in around the in response to what do you consider to be the aims of physiotherapy for joint hypermobility syndrome. Um, the highest response the highest response was where jointly advice and education was at the highest at around 96, just under 97%, and in around the in around additional sort of responses. The response around self management was sort of almost jointly of credence, which was around just under 90% in around self-management, and then sort of coinciding or where data was or descriptives had informed sort of jointly of similar importance, included physical activity, posture, posture, aspects around posture, and then aspects around goal setting, and then aspects around pacing, and where the percentage in around these had ranged from just under 51% up to just under 68%. Um, uh, and then in the data, or within the data, the other in around the other responses, frequently and sometimes and rarely and never and not applicable. The data had been more or less similar in around the same lot of a lot of responses in around what interventions do you use or utilize for joint hypermobility syndrome? The highest response was just under 97%, was around education. Um, just under 94% was enhanced self-management, and third was encourage long-term physical activity, which was just under 91%. And then sort of a joint sort of in synchronicity where responses where the responses were similar, included improve sort of muscle control, improve ergonomics, teach joint protection, improve function, increase strength, reduce fear and avoidance, and improve balance. These responses, where the responses range from 50%, around 50%, and around 50%, and just under 77% as all where response as responses were under the sort of sort of columns or response from this works. And then in around sort of frequently around the same sort of question about what interventions do you use or utilize for joint hypermobility syndrome. The highest response under frequently was increased strength, which just under 40%, and then similar under frequently included or where all the other responses were similar. So although pain relief was not reported as a high priority in terms of treatment plans, treatment in terms of treatment aims, pain was most often assessed as an outcome, suggesting a sort of a mismatch between clinicians' aim to achieve and what clinicians sought to or look to identify. I'll look to sort of observe in context of joint hypermobility syndrome. And so another part of this survey was what outcome measure do you utilize for individuals with joint hypermobility syndrome? And the highest response in around this was where the patients had always was in around there where patients would score utilizing a specific paining scale, which was where the highest response was just under 58%, and then where there were similar responses in and against sort of where patients would agree with a clinician against particular aspects of another particular aspect of joint hypermobility syndrome, and then also where there were similarities, which were all were similarities in around the percentage around where the response linked to always was similar, was in around strength, functional test, range of movement, and proprioception, and also against other particular measures. And so the conclusions around this were the results suggest or had informed that reported management strategies are broadly appropriate to long-term musculoskeletal conditions, but that additional training specific to joint hypermobility syndrome may be required, particularly in regard to diagnosis and assessment. It was not possible to comment on the appropriateness or effectiveness of current services or current service delivery, but there seems to be some similarity to those to those described for other musculoskeletal outpatient services. And so ultimately, further education and training may be required for physiotherapists to adequately recognize, diagnose, and manage and assess a joint hypermobility, looking at joint hypermobility syndrome, joint hypermobility syndrome specifically. So that draws this interlude to a close. This audio podcast as part of a Bulletin beat. This audio podcast as part of a Squadron Bloca. This audio podcast as part of a Labonics POCE, and this audio podcast as part of a Storm Robotics. This audio podcast as part of a Storm Robotics production. In the audio, in on social media, I'll link to this audio podcast. There will be some citations or references that are linked to this works. This collaborative works from 2013. This collaborative works from 2013 on diagnosis, management, and assessments of adults with joint hypermobility syndrome, or JHS. A survey of physiotherapy practice. A survey of physiotherapy practice.